welcome back to my channel. And for those of you that don't know me, I am Eliza. I'm a midwife and a perinatal mental health specialist from Sydney in Australia, currently living and working in Hong Kong. My social media platforms are Bump and Bub, if you want to go and follow me along there. So that question is how to avoid or minimize the risk of having a cesarean section. So a cesarean section is life-saving. It's an incredible tool that we have to keep mother and baby alive, and it definitely has its place in the world. I've worked with hundreds of patients who have had C-sections, and it's, absolutely amazing. But in saying that, we know that there are too many C-sections being done for not good enough reasons. So the World Health Organization recommends about a 15% cesarean section rate. Most countries are at least double, some triple that. So with having such a high cesarean rate comes a lot of other risks. I won't go too much into those, but obviously with major surgery comes a lot of risks with anesthetics, with higher maternal morbidity and mortality, with higher bleeding rates, or breastfeeding rates, all kinds of issues. It also causes a lot of issues, or can cause a lot of issues, for future pregnancies. So if you wanted to have more than 2 or 3 kids and your first baby is a cesarean section, yes, you can have the option of having a vaginal birth, but again, it depends on your provider. So I wanted to make a video with some tips about how to avoid a cesarean section if that's something that you want to avoid. So a lot of women would prefer a vaginal delivery over cesarean section. So here are some tips. Okay, so there's a lot of research on what interventions or what you can do basically in labor and even before labor that lowers your risk of needing intervention, meaning either being induced, having a C-section, something like that. So today we're obviously going to focus on C-sections. So let me jump in. So when you first become pregnant and you go to your healthcare provider, they will measure your height and your weight and they will get a BMI. So that's a body mass index. So from your body mass index, your health professional will then give you an indication of how much weight you should put on. So in saying that, of course, everyone is different, but trying to stay active, trying to stay healthy, very much get rid of those views from American movies which say, great, I can eat for 2. It's really only 300 calories roughly extra you need a day. So definitely try and stick with that if you can. So that's one of the biggest risks for cesarean sections, is putting on actually too much weight, not exercising and not being healthy in pregnancy. So this one is really important, especially as a midwife, because I see this all the time, and that is wait to come into hospital. So by wait to come into hospital, I mean a lot of women who haven't done educational classes during their pregnancy will have 1 contraction or 10 contractions and go, oh, I've got to go into hospital. And they end up coming into hospital, and what happens then is that we assess them. We know that this is very, very, very early on in the process of labor, and they get sent home. So we send them home because we also know that if you are well and baby is well, the best place to labor is in the safety and comfort of your own home. So that requires education in pregnancy to know when to come in. If you're unsure, you can talk to your midwife or obstetrician. Obviously, if you feel like, I don't feel safe at home, I don't feel comfortable here, you can definitely go into hospital. But just know that if you aren't in active labor, so meaning roughly 4 centimeters, your contractions are really consistent, coming every 2 or 3 minutes, and they're lasting 45 to 60 seconds, and they're really taking your breath away, that's active labor. So until that point, as much as you can, try and stay at home, have a shower, have a bath if your waters haven't broken, walk around, rest in the bed, cook, do some cooking or something to take your mind off it. But if you go into hospital at 1 centimeter and it takes you 4 or 5 hours to get into active labor, the risk of intervention definitely skyrockets, because it's just the way it is in a hospital setting, unfortunately. So we know from a lot of research that continuity of care, so this care by the same midwife or the same healthcare provider, really lowers your risk of intervention and a C-section as well. So in saying that, if you aren't able to see the same midwife continuously, it's really, really a great idea to have someone else come and support you during your entire labor and birth. So that can be a doula, that could be a private midwife, that could be a friend of and by a friend I don't mean someone that's going to hinder the process, someone that is, maybe has had a few babies by themselves and they really know how to support women, things like that. But generally not just your partner, because your partner feels for you as well. So if you freak out, your partner tends to freak out. So yeah, it's definitely really, really worth considering having a doula there, or trying to get into a continuity of care program where you know the midwife knows you feel really comfortable, and they also have the ability to get your psyche right so that when you think, oh my Lord, I can't do this anymore, they know that you can, and you know that they're not lying to you. So this is probably the biggest tip, and that is check your provider's C-section rates. So if you choose to go private with an obstetrician and you really want to avoid having a cesarean section for no good reason, which I definitely think you should, talk to your obstetrician. If they're someone that has an 80% cesarean section rate, you're not really going to want to choose them to provide you with the care that you need and you want. So it's definitely worth asking from the absolute beginning. I've definitely worked with a number of obstetricians who love to schedule in cesarean sections. I will leave it at that, but the same when traveling. I've mentioned this before, but I've been to South Africa a fair bit, and their cesarean section rate is astronomical, like ridiculous. And yeah, so definitely ask your provider what their opinion is on natural birth, what their opinion is on cesarean section, and definitely ask for their rates. So it's very easy for someone to say, oh yeah, I'm all for vaginal birth, and then at 39 weeks say, your baby's a bit big, let's just do a cesarean section. Don't get me started. Okay, so have a birth plan. And by a birth plan, I don't mean write it all out, laminate it, bring it to hospital, hand it to someone and expect it to happen, because it won't, I promise you. But by have a birth plan, I mean educate yourself. So educate yourself on what you want, what the options are, what's going to happen once you get into hospital or the birthing center, or even a home birth. Educate yourself on all of that information, and also educate your partner or your birth partner who is coming along, because at times they will need to advocate for you, they will need to advocate for your baby, because when you're in the throes of labor, it's not necessarily the first thing on your mind. So educating yourself means that if someone says to you, I think we need to have a cesarean section now, baby's, labor's slowing down a bit, and you have the knowledge to counteract that comment with saying something like, how about we try different positions first? How about we try an hour or two extra of being upright and walking around, or things like that. Being able to have a conversation because you have a education behind it is so important. So definitely, if you can, do classes, write out a birth plan. Obviously, the health of your baby and the health of yourself is the most important thing. I will never ever argue that. And if you need to have a cesarean section, you need to have a cesarean section. Any mother will agree that you're not going to risk your baby's life for the kind of birth that you would like. But in saying that, as I've mentioned, cesarean sections are way overdone, and we already know that. So it's definitely worth educating yourself and having options. Knowledge is power, so we all know that. So once you're in labor, what can you do to kind of get things going, to be moving along, getting your cervix to dilate? So the best thing that you can do is to be active, so changing positions. I want to quickly show you. So if you're in the one position for your entire labor, and baby's head isn't in a super optimal position, so baby's head isn't quite pushing down exactly on your cervix, your baby is going to stay in that position. So if you're walking around, so say baby's head's a little bit deflexed. So if you're walking around, you're moving, you're opening your hips, you're swaying, you're leaning over the bed, you're changing positions, it gives a lot of room for baby to be able to not come right out, but move their head position into a more optimal position, okay? So being active. So if you're in early labor, you're less than 4 or 5 centimeters, go for a walk, go and do the stairs. I know it's the last thing you want to do. You're exhausted, you're in pain, but that's why, again, education is key. So having your partner there to say, okay, come on, let's do 10 sets of stairs. I'm going to do them with you. So opening your pelvis, moving, swaying, going on all fours, using the birthing ball, the birthing stool. All of these different options are so important to get baby into an optimal position and to put that pressure on your cervix to get you into better, stronger labor and eventually have this baby. Okay, so say you want an epidural. Very, very common. Again, if you are someone that really wants an epidural, or even if you are someone that just ends up with an epidural because of different circumstances, what can you do to avoid a cesarean section? So, most midwives will do this anyway and really encourage you to do this, but again, knowledge is power. So every 30 minutes to an hour, try and move. So of course, if you have an epidural, you're in bed. Well, if you don't have a walking epidural, which tends to be in America, sometimes in Australia, I've never seen one. Moving positions in bed. So just because you have an epidural doesn't mean you can't move. So you can flip your left to right, you can lay down a bit flatter, you can sit perfectly upright, you can do all kinds of things. You can put a pillow between your legs to really open your pelvis up. Trying to move continuously, again, helping your baby out, helping them to move into an optimal position. So it's worth talking to your obstetrician or your midwife about that even long before you know if you're having a breech baby. So breech meaning baby is sitting upright in the pelvis. So we want baby to be cephalic, head down, but sometimes baby is sitting upright in a breech position. So it's worth talking to your obstetrician. What would you do if my baby is breech? What have you done in the past? Do you automatically do a cesarean section? What about twins? Are you comfortable doing a vaginal twin delivery? So generally with twins, the first baby needs to be cephalic for an obstetrician to consider doing a vaginal birth for twins. First baby needs to be cephalic, and baby number 2 can be breech. With a breech birth, there's a few options. So there's something called an ECV, which means manually turning the baby with an obstetrician. So that's an option. So it's definitely worth asking your obstetrician, is this something you do if my baby is breech? Obviously, the natural things that you can try are acupuncture, going to a chiropractor, doing different positions to try and encourage baby to turn. But if those all fail and it needs to be the medical route, know your options. So you don't necessarily need to have a cesarean section because baby is breech. Your obstetrician can try and do an ECV, and if they're not comfortable and they're not trained, ask about who you could be referred to. The other option is having a breech vaginal birth, and that's much rarer these days. But in saying that, if you're really set on having a vaginal breech birth, then finding a medical practitioner that will allow that or that will do that with you is really, really important. So a vaginal birth after cesarean, or VBAC, is definitely something that you really need to talk to your provider about. So I don't want to talk too much about that just because there's so many different circumstances. That would mean a woman could have a vaginal birth after cesarean safely or not. So one of the main indicators is how close it was to the last baby. So it's recommended to wait 18 months after your cesarean section to get pregnant again and have another baby, because the risk of uterine rupture is quite high because we have essentially cut open your uterus to take baby out last time. So if you would love to have a vaginal birth after cesarean, go and make sure that your healthcare provider is really supportive of that. Obviously things can change during pregnancy, but if at the very beginning they're thinking, no, not interested, and you've had the 18 months and you're a good candidate, choose someone else. Okay, and the last point is trust your body. Know that your body was made to do this. Your body was made to have babies. You can do this. Surround yourself with positivity, surround yourself with people that believe you can do it, and definitely take the time during your pregnancy to really think about it and know that your body really, really can do this. Thanks so much for watching another video, guys. I absolutely love chatting with you all, and if you like this video, please like and subscribe, and we'll chat soon in the next video. Bye!